Welcome to the Selecting Treatment Options for Patients Who Require More Intensive Therapy, featuring Dr. Robert Kushner, Professor of Medicine at Northwestern University Feinberg School of Medicine. He is assisted by Gail DeLuca, nurse practitioner at the Northwestern Medicine Center for Lifestyle Medicine. Dr. Kushner will examine hypothetical cases of patients with obesity and develop treatment plans that are tailored to meet their specific needs by focusing on psychosocial and intensified therapy based on medical risks. While these hypothetical patients may have other diseases or comorbidities, the focus of these case studies is on obesity management.
Gail, tell me about the patient.
The patient is a 48-year-old male who is coming in for a 3-month follow-up for his hypertension and follow-up on his labs for his type 2 diabetes. And he has overall concerns about his health. He just overall wants to be healthier and wants his diabetes under better control. He's just not at goal yet. He's at 7.6. So with his BMI of being 33.4, his type 2 diabetes, blood pressure is moderate control, 138/88. He has concerns about going forward and what are his weight-related and health-related comorbidities.
Mm-hmm. And how's he doing with his diet and his physical activity?
Well, from a diet point of view, his meals are irregular. He usually skips breakfast, has a reasonable lunch, and then has a much larger dinner, and then snacks all night, because he's just not satisfied.
Mm-hmm.
He did get referred to a dietitian 2 years ago when he was diagnosed with the diabetes and lost 20 pounds at that point. But since then, the weight has just kind of creeped back on.
Yeah. And any social or emotional issues?
It doesn't seem to be. He's married with 3 children. His work is sedentary. He's tired when he gets home. He gets to the gym maybe a couple times a week, maybe just 30 minutes. Mm-hmm. So he's getting about an hour of physical activity per week.
Okay. So how would you summarize him medically?
So medically, he has a constellation of weight-related issues. He has uncontrolled type 2 diabetes, he has hypertension, and he has his obesity. And I think he would really benefit from weight loss and increasing his activity.
Yeah. So he has a lot of targets of opportunity here, the way you present him. So you already mentioned increased physical activity. Sounds like we could do a lot regarding his diet from a lifestyle point of view, right?
Sure.
More consistency, meal rhythm, calorie control, and so forth. But I'm concerned about this guy, and I think you are as well. What do you think about potentially thinking about medications for him?
Well, I think that he would be a great candidate for medications down the road. I do share your concerns about him because he's 48 years old and he already has 3 large health issues. Mm-hmm. I think he would be a great candidate for that. The other question that I should have asked him is what changed in his diet and activity from when he saw the dietitian and lost the 20 pounds until now. I don't know if he went back to his old patterns.
Yeah, and I think he's also a good candidate for medications that could target his obesity and may also affect his diabetes.
Yeah, that's a good idea.
Let's go see him.
Okay.
Counseling on diet and physical activity are going to be foundational for this patient. That would help his diabetes and improve his blood pressure. I would make a referral to a registered dietitian very early in the process, including on this visit. Although he saw a registered dietitian in the past and lost 20 pounds, he's regained the weight. A revisit with a registered dietitian for medical nutrition therapy as a booster session would be very valuable. I think use of anti-obesity medication would be an excellent option for this patient. His body mass index is over 30 and has significant weight-related comorbidities such as diabetes and hypertension. It would increase his likelihood of losing clinically meaningful weight loss. Tell me about the next patient.
Well, we have a 50-year-old female who's here for a checkup on her diabetes. She has a BMI of 39.2. Concerning, her last A1C was 8.0, so her diabetes is poorly controlled at this point. She struggled with her weight all of her life. She's had weight issues since childhood. And she also has some weight-related comorbid conditions, including dyslipidemia and sleep apnea.
Yeah. Is she using her CPAP?
She is using her CPAP.
Okay, good.
Yeah. She's eating only 2 meals a day, And that second meal, dinner, and then she snacks consistently through the night all the way up till bedtime. As far as a weight history goes, each decade of her life, she's gained more and more weight, just incrementally she's gone up. And she's tried tons of diets in the past, but nothing has seemed to have any sustainability. She's tried commercial programs, she's been to see a dietitian, she's done self-directed programs, and nothing seems to be able to work for her.
Yes, that really speaks to the long-term chronicity of her obesity.
Exactly. Yeah. You know, so I think that she needs something more rather than the same old.
How about activity? What's going on with that?
Well, she's sedentary, and she doesn't have a formal exercise program. Although she does walk about 1.5 miles a day to and from the train, but that's about it.
Okay. So it sounds like a lot of things that we can do here, but summarize for me medically what's going on.
So medically, she has uncontrolled type 2 diabetes. She has coexisting obesity. They're probably interplaying together. She has weight-related comorbid conditions, sleep apnea, and she has dyslipidemia. And I think that right now, diabetes is a big issue.
Yeah. So what we can do for her, what would you recommend?
Well, I think that from the obesity point of view, that she needs something that can give her better, more consistent weight loss over the long term for that. Her sleep apnea is controlled, her sleep apnea is being treated, her dyslipidemia is being treated, but as far as her diabetes goes, she's taking 2 medications right now, and I think that there's other options that we could look at for better diabetes control.
Go ahead, so what are you thinking?
You know, at this point we could add a third medication, or, you know, she could even be a candidate with her BMI for weight loss surgery if she was open to that.
Yeah, so I agree with you. She's got a lot going on here. We could, and they're not mutually exclusive, right? They all work with each other. We could amplify and intensify her lifestyle because of the diet and activity. You know, I think she's also a good candidate for medications that could target her obesity that may also improve her diabetes. And she's also a good candidate for bariatric surgery as a long-term approach for her weight and improve her diabetes.
I was thinking that because of the failure of all the diets in the past. You know, if she had had some weight loss that was non-sustainable, but she has had no weight loss.
Right. I think that's good. So let's bring those options to her and let's see what she thinks about them.
Okay.
Let's go see her.
All right.
Reinforcing a healthy diet and physical activity is going to be helpful for Elizabeth and any patient who's struggling with their weight, in particular because of her diabetes. It's also going to be foundational if we intensify to using anti-obesity medication or surgery. I would be thinking of referring her to a registered dietitian on this visit. I think it's foundational for her diabetes as well as for her obesity. But in addition to that, we're also thinking about intensifying therapy to either anti-obesity medications or bariatric surgery. I think this patient is an excellent candidate to consider bariatric surgery. Her body mass index is nearly 40 and has uncontrolled type 2 diabetes and sleep apnea. She's also failed multiple treatments in the past. Bariatric surgery is one of the most durable and successful approaches for long-term management, including control of type 2 diabetes. She is a very good candidate for consideration of anti-obesity medication since her body mass index is over 30 and she has obesity-related comorbidities, including diabetes and sleep apnea. If she was not interested in bariatric surgery, I would absolutely be having a more detailed discussion of how anti-obesity medications work and how they'd be helpful for her. This was our last case. I hope you have a good understanding of the range of obesity treatment options available to healthcare professionals after reviewing these cases. Remember, a treatment plan is not accomplished in one visit. Obesity is a chronic disease and patients require ongoing evaluation and follow-up. In addition, you do not have to have all of the answers, but you should be able to provide resources and refer out to ensure the patient focuses on the desired treatment goals.